I'm Dr. Nerita, and in my 12 years as a urologist, I've seen men in their 50s, 60s, and even 70s dramatically transform their performance, not with pills or expensive gadgets, but by simply learning how to strengthen and coordinate these hidden muscles. Today, I'm going to show you the 5 best moves, a powerful combination of Kegel exercises and targeted stretches that you can do at home without any equipment to support firmer erections, superior control, and better bladder health. Stay with me until the very end, because the final move is the one most men skip, but it's the absolute game changer for lasting firmness and releasing chronic tension. Before we start, do me a favor. If you're ready to take back control of your vitality, hit that like button right now, and let me know in the comments, where are you watching from? Let's build this community of empowered men. For too long, the fitness and medical world treated Kegel exercises as something only for women, usually after childbirth. That is a massive disservice to men, and it's a myth we need to crush. The biological reality of the pelvic floor. Your pelvic floor is a muscular sling that runs from your tailbone to your pubic bone. It supports your bladder, your bowels, and, most importantly for this conversation, your sexual function. The locking mechanism. When you achieve an erection, blood rushes into the corpora cavernosa, the spongy chambers. But what keeps that blood trapped and makes the erection rock solid is the contraction of muscles like the bulbospongiosus and ischiocavernosus muscles right there in your pelvic floor. They compress the veins that normally drain blood away. The age effect. As you age, or if you spend a lot of time sitting, which is most of us, these muscles weaken and lose coordination. When they are weak, the blood can escape too quickly, leading to erections that feel full for a moment but then soften or fade before you want them to. This is a major underlying cause of what's called venous leak. The nerve connection. Strengthening these muscles also sharpens the neural pathways between your brain, your muscles, and your penis. It's like clearing static from a radio signal. The response becomes clearer, faster, and stronger. When you target and train these muscles, you are not just doing exercises. You are systematically retraining your body's natural erection reflex to hold blood more securely and respond more reliably. You are creating a stronger, more dependable foundation. In my 12 years of practice, I've had deep, honest conversations with men who feel tremendous emotional distress over their declining performance. They worry about disappointment, they avoid intimacy, and their self-esteem takes a hit. Emotionally, regaining conscious control over these muscles is incredibly empowering. It replaces the feeling of helplessness and decline with a sense of dignity and mastery over your own body. One patient, a 62-year-old accountant, told me, "Dr. Nerita, I finally feel like I have an active say in my performance instead of just hoping for the best." Practically, these moves can be done quietly and discreetly. They improve bladder strength, less waking up at night, and significantly reduce lower back tension, making you feel better throughout the day, not just in the bedroom. Let's dive into the 5 moves. We'll start with the fundamentals and finish with the ultimate game changer. We're combining simple strengthening with crucial flexibility. Remember, quality over quantity is the golden rule here. Move 5, the foundational strength builder, the pelvic tilt. We start with the bedrock, learning how to find and feel the muscles. The setup. Lie comfortably on your back, knees bent, feet flat on the floor, about hip width apart. Arms are relaxed at your sides. The action. Gently tighten your abdominal muscles, pulling your belly button toward your spine. At the same time, press your lower back firmly into the floor, tilting your pelvis slightly upward. You're trying to iron out the arch under your lower back. The biological explanation, co-contraction. This seemingly simple movement forces a co-contraction between your lower abdominals and your deep pelvic floor. These are the muscles that must fire together to lock blood inside the penis during an erection. You are teaching your core and pelvic floor to coordinate on command, building both strength and crucial body awareness, proprioception. The emotional effect, body awareness. Many men don't realize they can consciously control their pelvic floor until they do this move. It's like discovering a new muscle. This enhanced awareness is the first step toward better control to delay climax and maintain firmness. The practical application. Hold the contraction for 3 to 5 seconds, breathing steadily, then slowly release. Repeat 10 to 15 times. Focus on perfection. Over weeks, build up to holding for 7 to 10 seconds. Move 4. The stretcher and stabilizer, the prone cobra, sphinx. This move balances the strength we just built with flexibility while engaging deep stabilizers. The setup. Lie face down on a mat. Place your elbows directly under your shoulders, forearms flat on the floor, palms down. Lift your chest slightly, sphinx pose, keeping your neck relaxed. The action. Gently pull your belly button in toward your spine, creating space between your stomach and the floor. At the same time, lightly contract your pelvic floor, the Kegel action, as if stopping urine midstream. The biological explanation, flexibility, and synergy. This stretch lengthens tight hip flexors and the front of the abdomen, often tight from sitting all day, while forcing the deep stabilizers, transverse abdominis, and pelvic floor to contract in harmony. This balance of stretching and strengthening is essential, as tight hip flexors can actually impede optimal blood flow to the pelvic region. You're building flexibility and endurance, both crucial for sustained performance. The emotional effect, tension release. Men often report a noticeable reduction in chronic lower back tension and improved posture. When you stand and sit taller, you feel more confident, and less physical tension in the body means less tension getting in the way of natural arousal. The practical application. Hold the stretch for 20 to 30 seconds, breathing deeply. Repeat 3 to 4 times. As you progress, try to hold for a full 45 seconds to a minute. Don't hold your breath. Move 3. The core breath connection, the kneeling ab draw in. We're moving to all fours to truly link your conscious breath with precise muscle control. The setup. Get on all fours, tabletop position. Hands under shoulders, knees under hips. Keep your spine perfectly neutral. The action. Take a slow, deliberate exhale through your mouth. As you exhale, gently pull your belly button in toward your spine, flattening your stomach, and simultaneously contract your pelvic floor muscles. Visualize gently lifting your testicles or stopping urine. The biological explanation, endurance and coordination. This move activates the deep transverse abdominis, your natural internal weight belt, and trains the pelvic floor to work in perfect synchronization with your breath. This precise link, contracting on the exhale, relaxing on the inhale, builds the endurance and coordination necessary for better staying power during intimacy and better control over the onset of an erection. The emotional effect, conscious control. This is where men truly discover a new level of awareness of their pelvic muscles. Instead of feeling disconnected, you can sense and consciously control those contractions. This mastery directly translates to the bedroom, giving you the ability to stay firm longer and delay climax when you choose. The practical application. Hold the coordinated contraction for 3 to 5 seconds, maintaining smooth breathing. Release slowly. Repeat 10 to 15 times. Focus on the intentional timing. Over time, try increasing the hold to 7 to 10 seconds. Move 2. The stability pump, the bridge abduction. This move is a powerhouse because it engages the largest muscles in your body, your glutes, to support your core and pump fresh blood flow. The setup. Lie on your back, knees bent, feet flat on the floor close to your buttocks, arms at your sides. The action. Press your heels down, engage your glutes, and lift your hips toward the ceiling until your body forms a straight line. The bridge. Hold the bridge steady. Now, gently push your knees outward as if stretching a resistance band, and then bring them slowly back to the starting point. The biological explanation, auxiliary pumping. You are simultaneously strengthening the pelvic floor and powerfully activating the glutes and hip stabilizers. When these large muscles are strong, they act like auxiliary pumps, driving fresh, oxygenated blood where it's needed most to the pelvic region. Furthermore, holding firmness under the pressure of movement simulates the endurance and control needed during intimate encounters. Weak glutes mean compromised circulation. Strong glutes mean better delivery. The emotional effect, functional confidence. Men who stick with this move report not just firmer erections, but improved pelvic stability and hip mobility. This means less lower back strain and greater physical confidence and endurance during sex. You feel fundamentally stronger in your foundation. The practical application. Perform 8 to 10 repetitions of the knee push-out while maintaining the bridge. Hold each outward push for 2 to 3 seconds. Keep your core tight to prevent back arching. As you get stronger, use a resistance band around your thighs for extra challenge. Move 1. The tension releaser, the rocking frog stretch. Here it is, the move most men ignore, but the one that makes all the previous four dramatically more effective. It's the yin to the other move's yang. The setup. Get on your hands and knees on a padded surface. Slowly and carefully widen your knees apart into a wide V shape, going as wide as feels comfortable without strain. Lower down onto your forearms. You should feel an intense stretch in your inner thighs and groin. The action. Once stable, start rocking your hips slowly forward and back in a controlled, rhythmic motion. The biological explanation, the turnstile effect, chronic sitting and stress cause the adductors, inner thighs, and deep pelvic floor muscles to become chronically tight. This tightness acts like a tourniquet, restricting blood flow and creating excessive tension that makes it harder to achieve and easier to lose an erection. The rocking motion dynamically stretches and releases this chronic tension, allowing blood to flow freely and teaching the muscles the crucial balance between strength and relaxation. Too much tension causes premature ejaculation. Too little strength causes the blood to escape. This finds the sweet spot. The emotional effect awakening. Men notice a clear difference in firmness, sensitivity, and even the intensity of their orgasms. Some report that this single exercise awakens the pelvic region, allowing for a stronger, more responsive erection than they've had in years. It restores fluid, natural movement. The practical application. Spend 30 to 40 seconds in this position, moving gently with the rhythm of your deep belly breath. Focus on relaxing into the stretch. Repeat the stretch 3 times, with short breaks in between. Do not force or push into pain. These are not tricks. These are scientifically proven exercises that systematically retrain your body. The key to success is consistency and patience. Dr. Nerita's daily sequence, 5 to 10 minutes. Pelvic tilt, 15 repetitions, 3 to 5 second hold. Prone cobra, sphinx, 3 repetitions, 30-second hold. Kneeling ab draw in, 15 repetitions, 3 to 5 second hold. Bridge abduction, 10 repetitions of the knee push out. Rocking frog stretch, 3 repetitions, 30-40 second, gentle rock. Your homework. Commit daily. Perform this routine daily, ideally at the same time each day, first thing in the morning or before bed. Track progress. Keep a simple journal or notes on your phone and note improvements in firmness, control, and overall pelvic comfort. Expect results. You may notice subtle improvements in bladder control within 2 weeks, and more dramatic, noticeable improvements in firmness and control after 2 to 3 months of consistent practice. Gentlemen, please understand, age is not the final word on your vitality. You have an incredible power within you, the power to train, strengthen, and heal. The gradual decline you've experienced is simply a sign that these crucial, hidden muscles have been neglected. By committing to this simple 7-minute routine, you are taking a massive, empowering step toward your own health. You are choosing control over decline. These small changes will bring you greater physical comfort, greater freedom from worry, and the kind of quiet, deep confidence that allows you to fully enjoy life and intimacy. You are worthy of feeling strong, capable, and vital at every age. The strength of your foundation determines the strength of the house. By strengthening your pelvic floor, you are building the strongest foundation possible for your health, your confidence, and your sexual vitality. Remember, this is not just about a better erection. It's about feeling more like yourself again. Your final empowering steps are: commit today. Start the 7-minute routine tomorrow morning. Don't wait. Subscribe now. Hit that subscribe button for more evidence-based, judgment-free advice on men's health after 50.